Welcome, everybody. Good afternoon. My name is Sebastian Andriata. I'm the CEO and one of the co-founders of Kiana Analytics. And welcome to our webinar, From Pandemic to Endemic. I think hopefully you'll see some things of interest. I think some of the things that are coming up are opening up eyes to a lot of the corporate enterprise and university management as far as how do they proceed and survive in this next new normal that we're entering. We're going to talk a little bit about just how to open strategically, safely, and keep staff, students, employees, and others healthy. Today, we're fortunate enough to have some experts from a couple of companies. Dr. Douglas Thomas from Clear Lake Research, Christopher Peralta from Think One Future Bioscience, and the CEO of Kiana, Nader Fathi, who's also been very experienced in this last year on these matters. I'll let each individual introduce themselves, and then we'll move from there. So, Doug, do you want to explain a little bit about yourself?
Sure, thank you. Well, I'm trained as an immunologist and have been in the biotech pharmaceutical industry for about 30 years now, and have focused on emerging diseases and topical pathology and other areas that have brought me to the founding of Clear Lake, which is an innovation company that works primarily on dermatology problems and creating test formulations and ultimately commercializing those formulations out to the public.
Thank you very much. Christopher, you want to introduce yourself?
Good afternoon. My name is Chris Peralta. I'm actually a business development guy, not a scientist. I've done deals with, you name the company, Dropbox, Uber, Flipboard. I last mentored around 500 companies in Silicon Valley, created accelerator programs and immersion programs. But more recently, in the last couple of years, worked with amazing people like Doug Thomas here with Clear Lake Research. And we're also founding members of Think One Future. And we work on next generation diagnostics. Pleasure to be here.
Great. And Nader, do you want to introduce yourself?
Thank you so much, gentlemen. And thank you to everybody who is attending our event today. My name is Nader Fathi. I have been working on data analytics and artificial intelligence for the last 30 years. And it's great to be here with experts such as Dr. Thomas and Christopher to tell you more about what we see regarding COVID, what's happening today, and what we are seeing happening tomorrow. So with that, back to you, Sebastian.
Great, thank you. Yeah, so just some housekeeping. Feel free to go ahead and ask questions. I think some participants have sent some in advance already. Of course, you'll get the slides from this that you'll see here today as well, and we're going to clean up the recording and make that available as well for future reference. And of course, please feel free to comment, good or bad. Send us feedback to info@kiana.io, and that'll also be available at the end. So from an agenda point of view, we're just going to focus on COVID today and tomorrow. So what does that mean? It started out as a pandemic, but now it's looking more and more like this is going to be a continuing scourge, but something we're going to have to deal with moving forward. And that's part of the point of this webinar, is to see how do we manage that safely. We'll talk a little bit about what the protection is and the protocols for that, the testing that's necessary to do that, and then finally the tracing of how to use technology to help you do that. We've got a success story there, and then afterwards we'll do the Q&A. So please, if you want to raise your hand, that's fine, but we'll reserve the questions and answers for the end. And then finally a call to action and any other comments that the audience might have. So let's proceed from there. So Doug, this is you.
All right, great. Well, I think a lot of people wonder kind of how we got ourselves into it and what do we do in the age of pandemics. And pandemics are, no stranger in human populations, but human populations seem to respond very similarly as they see those around them getting sick or getting better. And the waves that we see, certainly from pandemic to pandemic, can almost be overlapped on top of each other. Primary, secondary, tertiary waves often seen, and they increase in size until either you end up with herd immunity, which means that a majority of people have had it and they don't get reinfected because of it, or we come up with a vaccine, an effective vaccine, which again has a similar effect as herd immunity. In the case of this pandemic, COVID-19, in fact, coronaviruses in general, and we're not strangers to them. We actually have a leftover from an 1890 outbreak that killed about 1 million people worldwide, but went back into kind of recession from the standpoint of how it damages humans, and became one of the common colds that we have today, one of 3 main common cold viruses. So these waves are caused by an initial rise in the number of local groups who are infected, and then they take usually measures to reduce it, whether that's staying away from each other or whether they've all become infected locally. But kind of like the embers of a fire, once the fire dies down, the embers are toward the outer edge of that fire, and it reignites because people come back out and they think everything's okay, and they get reinfected, but now it's a larger infection. And so these successive waves can actually, like I said, be seen in each of these diseases. And so waves are caused by human behavior, not by the infectious organism. What else is different is that COVID-19 is a very rapid mutator. It generates different versions of itself within one human, but also the more people are infected, the faster that this generation of variants occurs. And you can see in a couple of the first one's one that I like, but is more opaque. The second one shows where these variants are actually arising. And we already know for the North American variants, which are derivative from both Asian and British, and South American, which is coming out of Brazil primarily, South Africa, which has given rise to an African variant, and so on. And you can see that these different variants around the world then travel on flights with people. And so hopefully, a vaccine is able to withstand these variants. But the virus doesn't try to become more harmful. It tries to become more spreadable. And that's the only evolutionary pressure on this virus, is to become a faster spreader, and then it can kind of outspread its other variants. So next slide. Okay, so in the future though, what are we looking at then? We've got an effective set of vaccines. There's probably going to end up, we're going to probably end up with as much as a dozen different ones in different regions of the world. And but in the U.S., we already know that roughly a third of people are planning to not be vaccinated, and so this does expose us to reinfection. The virus itself, when it infects somebody, you provide immunity for roughly 3 months, but then it starts to wane, and so people have actually become reinfected with different variants over time, and so we can look forward to that. If we are just relying on what would normally be herd immunity. The vaccines, though, certainly the Pfizer vaccine has already shown this, and we expect this from Moderna as well, that the vaccine provides greater than 6 months of immunity. And so it's twice as long or greater than the current immunity. So this changes the herd immunity paradigm a little bit, and so it really helps us. But the variants themselves will continue to change we'll continue to get different variants, provided people remain infected and are passing it to each other. And so eventually some of these will overtop the vaccine itself. And AstraZeneca's vaccine in South Africa has seen just this, with the South African variant now being only 10% controlled by a vaccine. So as you look out towards the future, then we're looking at a world potentially, and this is actually based back on those waves that we saw, of a seasonal booster that we get. And that seasonal booster will probably cover the regional variant that is going around in that area, much like influenza. Okay, next. And then beyond COVID, which is a coronavirus, there are infectious diseases that are ripe for spreading. Though those that are pass through inhalation, exhalation, are the most likely to spread. This list here shows emerging and new viruses, and some of the ones that we see here may become the next pandemics. The key here, though, is because we've been served notice, and we've been served it many times. The planning and preparation for pandemics, planning both in companies, planning in governments, and planning as individuals will help us be prepared and shorten and perhaps make more shallow the pandemic before it does become endemic. I believe we've reacted a little bit too slowly on this one. In SARS-CoV-1 and Zika, we responded very, very quickly and kept these from spreading beyond where they did. And so I'm hoping the rest of this conversation that we're having today will help people understand what steps they can take to be prepared at the company level, and give them some clues also at the personal level how to keep themselves safe from this pandemic and future pandemics. Thank you.
Thank you, Doug. I'm going to pass it on to Chris, please.
Thanks, Nader. So what's going to happen next after COVID? So as Doug mentioned, the rollout of vaccines, building towards herd immunity, it seems to be slowing down the spread of new cases, but, will it really leave a mark on the behaviors of the human population? So will it change the way we interact at work, at school, shopping, at home? And one of the, frequent and proper hand hygiene, is one of the most important measures that can be done to prevent infection, with COVID-19. But, these hand sanitizers haven't really changed since 1966. So also, when you apply alcohol-based hand sanitizers, after 30 seconds, as it evaporates, you are no longer protected. So what can we do? So as Doug mentioned, we at Clear Lake Research, we've developed next generation technologies. In particular, we've created an invisible shield technology, and we've currently applied it to hand sanitizing. And we are focused on a gapless protection, that continuously protects even after hand washing. So hence what we call its persistence or long-lasting effects. It's also alcohol-free, so it's safe to use. FDA have endorsed 3 bioactives. One is ethanol, the second is isopropanol, and the third is benzalkonium chloride. And the first 2 are alcohol, and the third one is alcohol-free, and that's what we use in our product. It's also a high-end cream, so we also have moisturizing agents in there, making your skin feel protected, but also protecting from cracks and effects on the skin. You can also use it on a daily basis, and it's safe for use because of its persistence, and it kills 99.99% of bacteria, yeast, and molds, and envelope viruses for continuous protection. Our key unique selling point is really all about once a day application, and it's FDA certified with OTC designation. And we also make sure that it's built with quality in mind, so it's built under CGMP manufacturing. With our technology, we've also created and adapted it to use for masks. So we have a spray that can be sprayed on top of masks. It will be absorbed in 30 seconds, but it'll have the same persistent properties in terms of protection. So if you have any more questions at the end, please let us know. Next. Now, as schools, workplaces reopen, we also offer a testing solution with our partners. So alongside, hand sanitizing, social distancing, wearing masks, we believe testing is very important to really have peace of mind as your workers go back to the office. Particularly as as Doug mentioned, there are new mutant strains, and as the virus continues to stay in the population, it becomes more and more effects on us. So at Think One Future, we work with one, FDA and CDC approved labs, and two, medical professionals that can help provide no cost testing for your employees and also your family and their families as well. So companies or schools can have this coordinated testing program and help create a safer workplace. So if you're interested in learning more about the testing solution, there's pretty much 3 easy steps. One, let us know how many employees and family members you need to be tested, and we'll coordinate with you with your organization what's best for the community, either setting up potentially a pop-up clinic on your premises or your workplace, or testing your employees or students from home. Secondly, our team, our medical professionals, will assist with a customized intake form for your scheduling of the employees, their appointments. And finally, our team of medical professionals will also collaborate with your organization and perform the tests and send it back to our labs. And you'll typically get it within 24 to 48 hours. So if you have more information or you want more information, please contact us at info@thinkonefuture.com.
Great. Thank you very much, Christopher. So, and now I guess, Nader, this is your section.
Thank you so much. Thank you, Doug, for a wonderful overview of what is happening today and what we should expect happening down the road. And Chris, very informative information. Thank you for sharing. So very quickly, so we're going to now focus on some of the technology our company Kiana has been focusing on for the last, almost 15 months now, since we all got introduced to this new term called COVID and pandemic and contact tracing and all that good stuff. So these are all the new vocabulary that we all learn. This is, again, my first pandemic. I assume it's yours as well. So really, we are now, the good news is that I read on the paper that about 30-40% of the people in the US are vaccinated. Things are going back to normal. Actually, I was traveling last week for the first time. I was on the plane since last January, and airports were packed and hotels were packed, and things are going slowly back to normal. And we see companies are now opening their doors and letting employees back in there. Now, the big issue companies need to keep in mind with technology is the following. Number one is that they need to protect personal privacy. Again, the data we're talking about here, not only you're talking about health data, also known as HIPAA, but you're also talking about personal identifying information. So again, protecting that data is very important. You need to comply with the applicable law there. The second one is really reducing the organizational risk. If somebody is sick within your company, he or she not only is going to infect others, but also their family members. You unfortunately, if you get sick, you go home, you're going to get your wife, your sister, your grandma sick, which is not good. But also the company may have an issue. Actually, I was talking to a gentleman from a school district, and he was telling me that they had to shut down their school district 4 times. And each time this cost that district about $4 million. So they wasted about $26 million over this $24 million over this time period because they keep opening and closing the school. So again, the risk to the organization is huge. And in some cases, you may even have to shut down the organization. And OSHA also want to make sure that there's no issue when it comes to workers. Fast response is a key. As soon as you find out somebody is sick, you need to be able to ask that individual to go isolate and stay away from the campus. And then the other one is that what do you do with this technology if and when COVID is finished? You do not want to buy what we call disposable technology that you throw it in the trash, right? You want to be able to use this for other application if and when COVID is done. So our company, Kiana, we have been working on big data and AI for the last 9 years. Really, what our focus is to make intelligent facility a reality. The way we do this is that we basically identify mobile devices in a physical location, and we can do this with a very accurate, what we call RTLS, which is a real-time location services. Everything we do is around privacy. Privacy is the center of everything we do. And we can do this because of some of the key patents we have in this area. On the right-hand side, you can see some of our recent customers and some of our partners. Again, we are a global company. We have offices in the US, in Europe, as well as in Singapore. All right. So what we do, again, on the right-hand side of this slide is our vision of what we call a smart facility. A facility is really more, smart facility is really more than do I have LED lights and do I have solar panels. A smart facility, of course, needs to be secure. You need to be able to make sure people who are coming in, not only your staff, but also visitors, stay healthy. You need to manage visitors and assets. You need to manage your power. And last but not least, after people, real estate is the most expensive capital you have in any organization. So how do I utilize my facility, right? So this is really our vision of a smart facility. And again, I want to emphasize what's in the center is privacy. Again, in this case, what we did, we built a solution with privacy being in a center. It was not really an afterthought, right? So, and I will talk more about this. No, so what we see on the middle here is our platform, our Kiana platform. So we have what's called an IoT platform, Internet of Things platform, which allows us to sense various sensors in the building. Again, we are a pure software cloud company. What we do, we listen to the existing sensors like the Wi-Fi in your building. We bring this to our system, we assess it, and then we have an AI-based rule which basically takes this data and targets it to the people who need to take action on that data. You see on the right-hand side, the stakeholders, the building owners, environmental health and safety, facilities, security, human resources. Those are the different people who look at this data from different angles. All right. So what we do in the case of COVID is that everybody on a campus or a factory or a hospital are carrying some kind of a mobile device. And this really system is based on self-registration and self-reporting. So if somebody is tested positive, he or she goes to somebody in HR or health services, and then our system automatically identifies everybody else that they have been in contact with. We use the CDC guideline, which says if you were with somebody more than 15 minutes a day, and then we go back 10 days and we look at zones. Again, remember, this virus travels through air, so zoning is really important. We can be able to identify everybody else that have been exposed to the person who was tested positive. The other issue with COVID is that areas which needs surgical cleaning. Okay, so not only you need to know people, but you also know where is it you have to go clean. For example, we're working with a university which has 90 buildings in this university. Imagine cleaning those every day. It becomes very expensive. So being able to identify which one was it that we saw expose people to COVID, that makes it much easier. You have to be able to enforce physical distancing. And now that companies and universities are going back on campus again, how do I redesign my facility? The data we have from 2019 doesn't really help us. We really live in a new environment. And last but not least is that we see more and more state and federal regulations when it comes to COVID and reporting of COVID. For example, in California, we have a new law which went in effect January of this year called AB 685. And what AB 685 does, really extend the OSHA authority. And it says that if anybody within your organization was tested positive for COVID, you have to provide a written notice within 1 business day to everybody else, right? And this is pretty a harsh penalty. It's $25,000 per violation. And by the way, I don't know if you have seen it on the news, but companies such as McDonald's, I think Amazon was fined. I also saw Kaiser hospitals were fined and so on. So the fines could get pretty high and expensive. And we also see the same law actually being extended to other states in the US as well. Here you see the partial list. Actually, there was we saw a news this morning that Washington State is actually doing a version of AB 685 in their state as well. So we see more and more companies are required to provide this. Now, if you have a company which is more than 50 people, doing this by hand is almost impossible. It's very time consuming, is error prone, and that's where we're coming. We can basically automate this technology for you. For example, Sebastian and I live in Santa Clara County in California, and Santa Clara County actually last week announced that they are now asking all the employers to record everybody who is vaccinated, right? So again, this is a law which went in place in Santa Clara, and you need to be able to do this. What you see here on the left-hand side of this picture, our system, you can go ahead and not only flag everybody who was tested positive, you can also flag vaccination. So again, this is all automated. If and when you are audited, this data can be available in a push button sense here. All right. So what I'm going to show you here is some examples of the screenshot of our system. Again, remember, this is all a web-based system. We do not install any software or hardware. We're using the existing environment that you have. And then the first example here on the left is what the health services will look at. So here we have, let's say, an employee called Miss Luna, and she was tested positive. The system automatically comes back and it says, hey, who else was she with the last 10 days, and identifies them as being also infected. The other one in the middle is the view that the facility may have. Facility may be interested to see which areas is it that they need to go clean. In this example, you see floor 1, zones 1 and 2. That's where those infected people were. So facility needs to go there and do some deep cleaning, surgical cleaning. And last but not least, we provide you with a what we call a real-time heat map. We can show you exactly where are the concentration of the people, right? So again, if you're enforcing any kind of social distancing, you may want to say, you know what, we need to do something in this area, which is highlighted in red. All right. There furthermore, we do some advanced analytics on this data. One of the top one is that was requested actually by one of our customers when we implemented, is what they call the top site. So we can identify in a corporate facility or a university or a factory, where are the areas that we see majority of the exposures are happening, right? And when you click on it, what it does, the system brings you and actually highlights you on the location map itself. So it tells you where are the exposures, how many people, how long were they in this location, and so on. So this really helps you to redesign your facility so you can prevent any kind of exposures going forward. And then also we provide a dashboard. This is an executive dashboard, also known as a customized key performance indicators, which tells you how your organization is doing, right? Are you getting more infection or less? How many people are vaccinated? Where are the areas that you're seeing more exposure and so on? So this is, again, a very powerful management tool, which allows you to monitor the health of your organization and see if the rules and the policies you're putting in place are making sense or not. All right. So how does it all work? As I mentioned, we do not install any hardware or software. All the devices that your employees or your students carry are pinging the Wi-Fi which is in your building, right? So again, this is the data which is already available. What we do at Kiana, think about it, that we're putting a flashlight on that data, and that data, we're making it actionable information. So this data could come from Wi-Fi devices like your cell phone, your Apple Watch, your laptop, or it could come from some badges. For example, Bluetooth badges is very now popular, right? So this gets collected. What we see is basically the device IDs. We see the location of the access points, and we see the timestamp. This comes to our secure cloud, and we basically analyze it. The nice thing about this solution, again, is that we're not looking at any other data. This data stays within your own four walls, and the data we see is all encrypted. Again, I want to emphasize that privacy is the center of everything we do. What we have done here on the left-hand side, you see some of the key Wi-Fi manufacturers that we have partnered with. Companies such as HP Aruba, Cisco, Extreme, CommScope Ruckus, and Fortinet. These are what we call the B2B Wi-Fi manufacturers, which is already have installations across the globe. All right, so a little bit about the success story. What we see is that we have been able to help companies not only prevent COVID exposure, but really help them with space utilization. Here you're seeing a picture of a corporate campus. We can tell where the people are, how long do they stay in a location, what is the occupancy, what's the capacity, as well as area transition. What you see here are the arrows. We can tell you, for example, how many people are walking from conference room A to conference room B, right? The same technology also has been used for asset and visitor management, right? So again, you want to know where the assets are. When visitors come to your facility, you want to know where they go and so on. So again, we can use the same technology to extend that as well. So there have been variety of solutions out there since COVID was introduced to all of us last year. And what we see people have been doing are the following. Number one is the manual contact tracing. Manual contact tracing is someone is calling people and asking them, who they were with and so on. Again, it's very error prone. It's not timely, and really not much privacy protection there. So that's method number one. Method number two, I'm sure you all know that there have been Bluetooth apps. And I think Google and basically Apple were the one which introduced this app, which basically look at your devices and based on that can tell where you are. Now, the Bluetooth apps are error prone because Bluetooth signals go through window. So if you're across the window, it will tell you that you were exposed to COVID and you were not. The other issue is that unfortunately this data was hacked. I don't know if you saw, but the Android data was hacked, and the fact that this data is sensitive was an issue there. So again, not very popular, not that many people actually use that product. Now, what we do on Kiana is that, again, it's digitized, automated. It does not require an app. It uses your existing infrastructure. And again, as I mentioned, the data stays within your own four walls. We never see any personal identifying information. All we see is a bunch of numbers that we are crunching, right? So in that respect, and that's what our customers like. They like that, the fact that there's no hardware, no app, and again, privacy being center of everything we do. With that, let me pass it on to you, Sebastian, to maybe you can read some of the questions that we have received.
Yeah, no problem. Thank you very much, Nader, Chris, and Doug. That was actually very informative. Hopefully the audience had some interesting takeaways. So having said that, actually, some people did in advance send some questions, and I think but in any case, I've got some questions now, and let me start with I guess one for Chris here. It reads, the market is flooded with hand sanitizers. How are you uniquely positioned to help companies reopen?
Thanks, Sebastian. I guess I'll start. Maybe Doug, you might want to add. So yeah, we're seeing that there is a lot of alcohol-based hand sanitizers in the market. I think from our point of view at Clear Lake Research, we have I think three things that we're positioning ourselves. One, against alcohol-based sanitizers. One is, as I mentioned, persistence. So You can apply our hand sanitizer with our invisible shield technology once, and it will continuously protect you throughout the day. Secondly is the economical value. So today when I'm going out and about, I'd most probably go to different locations and put sanitizer on. Now with my persistent sanitizer, I would put it on once and it'd last me all day. So one-time use. And I think the third thing is we're going to start to see the effects of the alcohol to not just our skin but our body. After using alcohol-based hand sanitizer more frequently. So I think safety might be one thing that we're really going to be focusing on. And our product is alcohol-free using benzalkonium chloride, which is an actual bioactive endorsed by the FDA, WHO, alongside these alcohol-based sanitizers. Doug, did you want to add anything?
The formulation's a cream formulation, and so we're calling it extra strength sanitizer, and you apply it and it smoothly goes on. And because the product is considered to be safe and effective against a broad variety of microbes, this will be good protection for children going to school where you can't monitor their use of alcohol, and whether that's good or bad even. And like Chris had intimated, this gapless technology provides you gapless protection between uses. And so I think that it will serve notice certainly to other companies that are making alcohol-based sanitizers, which have been around for a long time now, that new technology needs to be built and deployed so that people can have this sort of protection and not have to worry about carrying around large bottles of alcohol.
Thanks, Doug.
You're welcome. Great. Thank you very much. Actually, yeah, I'm all for saving alcohol for what it's intended to do, right? Fuels and cocktails. So that's great. So there's one here for Kiana, for Nader. In our facilities, we're not allowed to use mobile phones. I think maybe because of factories. How can we use this solution in that kind of under those conditions?
Correct. Yeah. So we have seen facilities which, for whatever reason, they cannot or do not have any smartphones, right? So example of that could be elderly care facility. It could be schools or factories. As you mentioned, factories, both for security reasons as well as for safety reasons. They don't want their factory workers being playing with their phone while there's heavy machinery moving around. So in that case, we can provide what we call Bluetooth badges, right? So these are the badges you can wear on a lanyard, or they be like a wristwatch. So they work exactly the same. They will be assigned to an individual. So we know badge 1 belongs to Joe, let's say. So in that case, it will work exactly as it will be. So and by the way, you could use this for visitors as well. Visitors coming to your facility may not want to log in with their mobile device to your Wi-Fi, and in that case, you can just give them a Bluetooth badge. So long answer to your question, Sebastian, but basically we can help you with providing Bluetooth badges, which will do the same thing as monitoring and sensing where the individuals are and who they were in contact with.
Great, thank you for that. Yeah, there's another one here for Chris. Realistically, it says here, do we need testing now the vaccines are being rolled out?
Great question. I guess I'll start it from my point of view and what I've read, and then Doug and anyone else can add here on the panel. I think, we heard through Doug, about herd immunity. I remember reading somewhere that 1 in 4 Americans will not take the vaccine. So that takes out 25% of the population. And I think there's also a lot of the population that are the main carriers or that are spreading it is the asymptomatic cases, particularly kids. So I think, it's good that the kids are starting to get getting the vaccine now as well, which is good. But I think heading towards herd immunity, whether it's the 70, 80, 90%, I think that's one thing that we have to look out for. I think secondly, how effective is the vaccines? What's the efficacy? What I read previously, I think it was around the 85 to 95%, for the J&J, Moderna, and Pfizer rollout. So I think it's still pretty early. We have to also look at that. And then the final thing, from my point of view, is you start to see, these new variants emerging. It's really scary. The variant from India and the super spreader. It's spreading in a lot of different countries. How fast can we really adapt to these new variant strains? I guess, Doug, from a scientific standpoint, what's your thoughts here?
Certainly, one of the things we've learned through this process is that it still takes us a while to produce the traditional vaccines, and the development of the new generations of vaccines, these RNA-based vaccines, allows us to develop vaccines faster and basically do the testing faster. These are basically platform technologies that are highly adaptable. So I think for a lot of companies that produce traditional vaccines, they may be out of the game once variants start to become more of the rule. They just won't be able to respond quickly enough. And so the future probably will be these, vaccines that are able to be quickly developed and relatively quickly deployed, because they still have to test for safety and effectiveness. And the public will grow more used to them. So I think that's the future of the vaccines, if that answers the question.
Yes, and so I think it's really peace of mind. Making sure that everyone's tested before they go back to the workforce or to the office or at schools. Just having that peace of mind. We see that we're getting feedback that it's important, and it's no cost testing. So, if you want more information, let us know.
That's great. Thank you very much. Yeah, I mean, I should add in my 2 cents. We're already getting feedback from existing customers at both university and some factories that they've already, in the last few months, have had people get sick, knowing that they had already had the vaccine. So it's actually kind of interesting. Now, it's not large a population of people, but it's not zero, which was interesting. We have a few more minutes for a couple more questions. There's a couple that came in for both you, Chris, and also one for Nader. How do I protect my investment after COVID is done? And with that, they want to know how fast can any of these types of solutions that we're offering be rolled out?
So, Sebastian, let me take a shot at that one there. So first of all, really what we need for Kiana to basically deploy our solution at your site, we really need few things from you. Number one is that we need to work with someone within your IT organization, which can help us with the location of the access points in the building, and then also provide some kind of a floor map, and then basically push this data to us. It's very quick. I mean, we had customers up and running in a matter of half a day or something. It's pretty straightforward. So the implementation is pretty fast. And then regarding investment, as I mentioned, and I'm going to talk about a real case here. So we work with a university in Chicago called Dominican University. And initially their interest was around COVID and digital contact tracing. But very quickly, when they saw the power of the system, they said, wow, we could use this also to manage our buildings, right? So they really wanted to do what I call the site and facility management with the same technology. And we're even talking to them now regarding asset management. They have some equipment that they want to make sure they know where it's at and make sure it stays secure and in place. So again, here's a good example of, today the hot topic is COVID and contact tracing, but the same technology can be used for other information. I did mention that school, which lost $24 million, and one of their needs is actually shooter on campus. So one of the things they wanted to do with this technology is to make sure to keep the right people within the school and keep the people who are what we call the undesirable not entering the school. So if they do, they can raise a flag. So those are examples of how you can extend the same solution, what we call intelligent site management, to be able to protect your investment.
Yeah, thank you very much. Unfortunately, that problem has not gone away, as we just found out today in San Jose. Chris, there's another one here. The market is flooded, obviously, with hand sanitizers. How is it that your company and you folks are uniquely positioned to help, companies and schools reopen?
What I wanted to mention is that, we have two things here. The first thing is, Think One Future, the DNA, or how when we first started, we actually were a social entrepreneurship platform. So our mission here is to really help communities. So I think that's the first thing to note. We really want to help in the reopening. We want to help as much as we can the families of the employees and students. So the DNA is really a community service here that we want to help communities as well as displaced communities as well. Secondly, if anyone needs testing done in the organization, our medical professionals will customize any program that works to your needs. So whether it's, as we mentioned, set up a pop-up clinic at the office or car park, or at the school, or test sent at home, or helping community get tested, no cost testing. We have certified billers to help out to understand, the back end. We provide, we have some amazing partners that could help out. But the long and short of it is we are trying to bring together, and this is where this amazing partnership with Kiana comes in, is we call it a protect, test, trace, trust solution. So protecting in different methods or modalities like hand sanitizing, testing to get peace of mind as you start to reopen, the testing, which is the contact tracing solution provided by Kiana. And, hopefully then there's a bit of a trust that there is a safe reopening of your workplace or your school.
Sure.
So if you have any further questions, please let us know.
Great. Yeah, thank you very much. For the sake of time, I think we can only do one more question. I think this one is actually, I should have asked this earlier. This is more important for me, I think. Nader, so what about privacy? You touched on it briefly, but maybe you can give an overview about that.
Sure. So on the privacy side, we at Kiana, we never see any personal identifying information. We do not have any information regarding people, nor actually the real device ID. What we do is that we look at the device IDs, and it's encrypted before it comes to our system. And really what we are crunching is a bunch of numbers without knowing who those people are. Now, what we do is that, again, we push these numbers back to the health center or the human resources, and they are the one that they basically map those devices to the people's name. So, for example, if device 123 belongs to Joe, and Joe was infected, he's the one that HR will see that, oh, wow, we better go basically contact him and let him know that he needs to stay away for the next 10 days. Now, also, the system has the right login privileges. Not everybody, of course, have the access to the system. You need to have right privileges to look at that. Same as people who are looking at your financial data, or you're looking at your health data or whatnot. Not everybody in the company can look at this. Only people with the right login and right privileges can look at that. So again, we as a company do not see any personal identifying information. That data stays within your own four walls, and it does not get shared with anybody outside of your organization and the people who have the right login and right privilege to take a look at that.
Great. Yeah, thank you very much. I think that really is critical to make sure that people participate on campus work and whatever. So I think we can wrap it up very quickly now. Again, thank you all for participating, and for Doug and Christopher to share some of their experiences and their knowledge on this. On the slide, you can see that we've got links to both Think One Future and Clear Lake research. We've also got some available white papers on the Kiana website. There's a link also to the AB 685 compliance website, which, by the way, is really supported nationally, but the term really relates to the California law. And then finally, with Kiana, we can actually give you a free assessment and explain a little bit of what the industry best practices are, and show you how effective digitizing your workspace really can be for you, your business, and your employees. Finally, there's some links there for you guys for the audience to send us any information or questions. Feel free, please, to share with your own thoughts with us. We'd love to be able to understand better what your needs are. So, having said that, I'd like to thank everybody who's participated and everybody who's joined. Again, thank you very much. Goodbye, everybody.
Thank you.